Welcome to the immobilization of the supine patient. This is a 10-minute skill station. I'm going to begin. My BSI is on, checking to make sure that my scene is safe. I'm going to direct my partner to come in. I'm going to ask him to hold C-spine manually in a neutral inline position. Second part to that is I'm going to ask him to hold C-spine manually and don't let go for the duration of the station. Next, I'm going to assess for PMS in all four extremities. I'm going to check for radial pulses bilaterally. Pulses are present. I'm going to check for motor. I'm going to ask the patient to wiggle his fingers. And then sensory, I'm going to squeeze the fingers on the hand and ask if the patient can feel it. Need to check for PMS in the foot. In order to do so, I'm going to remove the socks. Checking for pulses bilaterally in the feet. Motor, I would ask the patient to wiggle his toes. And sensory, I would ask the patient if he can feel me squeezing. Next, we need to measure and apply for the appropriate size cervical collar, measuring with 4 fingers from the trap muscle to the angle of the jaw. Going to measure appropriately. Make sure I snap in cervical collar. Position the cervical collar around the patient's neck. Now that the cervical collar is applied, I need to obtain my immobilization device and take my backboard, slide it into place. Second respirator is going to help me to get the patient onto the backboard. First, I'm going to slide this board up higher than the patient, higher than his head. Put the board as closely as I can to the patient. I'm going to grab the patient at the waist, the shoulder. C-spine's count, we're going to lag roll the patient towards myself. 1, 2, 3. Patient's on the side. We're also going to slide the board again back in, a little bit higher than the patient's head. C-spine's count, we'll lag roll the patient back onto the board. 1, 2, 3. Okay, now I need to make sure that I center the patient onto the board and that I place the patient on the board where he should be. I'm going to make sure I put down a headbed. Headbed is secured to the board. I'm going to ask my partner to grab the patient, the lower legs at the ankles. He's going to help me to slide the patient up. I'm going to grab the patient at the torso. Patient has to move up about a foot on C-spine's count. 1, 2, 3. Okay. This time I need to secure the patient to the longboard. Start with the torso strap. Strap for the hips. Strap for the lower legs. securing the torso first. I'm going to secure the chest straps. Make sure the arms are secured also. Now secure the patient's head to the backboard. Head is now secured. I'm going to reassess PMS in all four extremities. Checking for pulses. Motor, it asks if the patient can wiggle. Sensory, squeezing his hands. Checking for pedal pulses. Motor, it asks if the patient can wiggle his toes. Sensory, I'd squeeze, ask to see if the patient can feel. I'd also make sure to pat any voids beneath the patient. Some voids underneath the patient's ankles. Check for any other voids beneath the patient. At this point, I would consider rapid transport. I'm done with this station.